Hi there, I am Tom Keane, the HHS Assistant Secretary for Technology Policy and National Coordinator for Health Information Technology, and I have the pleasure of being here today with Mr. Mark Cuban from Mark Cuban Cost Plus Drugs. How are you, Mark?
I'm great, Tom. Thanks for having me on.
Yeah, thank you for joining us. I have the privilege of heading up an agency at HHS that deals with health technology. And the thing that I love about technology is that unlike other areas of healthcare or other areas of the economy, technology can actually be a free lunch. And I know that you've had tremendous amounts of wins with the Mavericks, with Shark Tank, and throughout your career. But if you could for a minute, why don't you take us back to the 80s and 90s when you were a tech entrepreneur and had the foresight to see how the internet can be leveraged for broadcasting and for communication. Take us back to that because I'd like to talk about health
Sure.
tech today.
Yeah, I mean, being a geek for a long time, I was always into technology, and it was 1995 when a fellow IU Hoosier, Todd Wagner, and I got together for lunch at California Pizza Kitchen. I'll never forget. And he was like, Mark, how can we listen to Indiana basketball in Dallas, Texas, using this new thing called the internet?
Mhm.
And back then, literally for us to listen to a game against your alma mater, Illinois,
Right.
what we would have to do is have somebody in Bloomington, Indiana, put a speakerphone next to a radio, and then we would have a speakerphone down in Dallas and maybe some adult beverages to go with it and listen to the game. And I was like, okay, let me try to figure this out. And so we started a company called AudioNet and figured out how to take a feed from a radio station and then encode it onto a hard drive and let people download an application to be able to listen to it.
Mm-hmm.
Well, back then, that was complicated,
Yeah.
and it evolved over time to where it got more simplified, where I'd say by 1996 in AudioNet, here are the steps you had to take. And this is, we called it internet broadcasting then, it's
Mm-hmm.
streaming. And so what you needed to do, you need to have an internet subscription,
Mm-hmm.
right, from an internet service provider. You needed to have their software that they use to give access to the internet.
Mm-hmm.
You need to have something called a TCP IP client
Right.
that gave you access to the network. And then on top of that, you needed to have a streaming client. So you had these four pieces of software that you needed to have to download, which is complicated for 99% of people who barely knew how their modem worked,
Right.
right? But in doing so, we gave people access to content they otherwise were not able to get. To listen to that Indiana Illinois game, to listen to a Chicago Cubs game, to listen to your favorite radio station. And we had hundreds of internet only radio stations that we created as
Yeah.
well. And so in doing so, we kind of set the path for people getting that technological understanding. And then we knew that it was going to simplify. And I think that's really relevant to your question, that things start off a little bit more complicated than you would like or that you would expect. But over time, entrepreneurs and technologists simplify everything so that we went from having to install all that just to get a postage stamp sized video to
Mm-hmm.
now turning on Netflix or Peacock or whatever, and it's there without us having to think or do anything.
Well, this is why I'm so glad that you're getting into healthcare entrepreneurship, because let me tell you how we do prior authorization right now, or how we do prescription management right now. Right now, we have electronic health record systems in virtually every doctor's office in the country. And if the doctor needs a prior authorization, that doctor's staff will actually print out the electronic medical record, will fax it to the insurance company. A human being at the insurance company will receive the fax and enter it into the computer. The computer will adjudicate the prior authorization, and they will fax back an authorization. That is the current state of play. And one of the things that we did this summer, my colleagues in my agency, we implemented some standards to allow the computer at the doctor's office to actually talk to the computer at the insurance company, so we can disintermediate the fax machines so that there doesn't have to be a human in the loop managing all of this. And it's our vision along with our colleagues at CMS, that by the end of this year, maybe the beginning of next year, we should be able to see most of these prior authorizations be adjudicated in real time by the computers talking to each other. Yes.
And that's great. I mean, when I got into this, Paul, our colleagues would tell you, the amount of use of a fax machine is stunning. I mean, I hadn't seen a fax machine in years, but we had to have them, and they're still used, and doctors' offices in many cases prefer them, right? Because it gives them a physical record. And I really, I've been following what you've been doing, and your approach to data liquidity is right on target. I'm a big believer throughout my entire career, touch once, make available to everybody. And I think that's really where you're going with this. Once the data is in the system and it's digitized, there's no reason for it to be physically printed. There's no reason for anybody to do anything but review it and approve it or comment on it so that you can become smarter in your decision making.
100%, and all of the logic can be coded into computers and be done by computers. But prior authorization for medical procedures is only part of the equation. As you know, drugs, pharmaceuticals, people getting drugs are a great challenge, people being able to afford drugs. So the other standard that we adopted was for the ability of electronic health records to display in real time the costs of drugs that patients are going to face at the time that the drug is being prescribed. So now when a patient goes to a doctor's office, the doctor can not only see how much will a chosen drug cost, but can actually see how much therapeutically equivalent alternatives can cost, so that the doctor, in conjunction with the patient, can choose a drug that will allow the patient not only to get the best therapy, but also be able to afford that therapy. And we're very excited about that. And I should give a shout out to my colleagues who did this. The guy who is our career deputy, Steve Posnack, had a big hand in making this happen. And our chief pharmacy officer, Tricia Lee Rowell, had a real hand in making this happen. And I think it's important that people who labor in the dungeons of government should, who've done so much for the American people, should get a shout out.
Absolutely. Way to go, Steve and Tricia. Absolutely. Yes. I couldn't agree with you more, because historically, and this is a fundamental beginning for costplusdrugs.com, historically, when you go to the doctor and they tell you you need a prescription, the only thing they ask you is, what pharmacy do you use?
Right.
That's it. And then they'll send it with, and then the pharmacy tends to be the one to adjudicate the prior authorization and everything that has to happen. And if they can't resolve it, it has to go right back to the doctor, which is crazy in many respects, because, to your point, they have all the electronic health records. It's just a matter of, using logic and using the doctor's judgment to make the right decision. But now with what you're doing, I think the only thing left to add is cash prices from folks like costplusdrugs.com, right? Because, as you make a determination, what is the best offering for the health of the patient? But if there's a prior authorization that's going to potentially get denied, what are the therapeutic options? What are the lower cost option? And is cash price a better option once you see the copay? Because the one thing the doctor can't control is the copays and the deductibles that are set in the plans. And if by chance they're looking at a plan, and that's what the real-time benefits check does, if by chance there's a plan and the copay or co-insurance, because of the choice of plan that was made, is way out of whack, way out of line, yes, pick a cash option for sure and save a lot of money. That's a big part of our business at Cost Plus Drugs.
So I'm really glad you brought up Cost Plus Drugs, because the one thing that is missing from the health tech ecosystem right now is the cash pricing, which not only empowers patients, but can provide them a very powerful alternative to insurance. So I'm going to tell you a story about an experience that I recently had, and you can tell me how Cost Plus Drugs can actually correct this. So I had a cold, and normally, being a doctor, I don't go to the doctor when I have a cold, I just tough it out. But this time I figured I'd go to the doctor, and it turned out that I actually had influenza A, for which there is a drug, Tamiflu, that you can use to treat it. So I told them, okay, send it to an online pharmacy. So they sent it to an online pharmacy, but it turned out the online pharmacy couldn't fill the order for 5 days, and by then it's too late. You've already got the cold. So I walked into the local pharmacy and said, I'd like you to transfer the prescription here. Problem number one is they weren't able to transfer the prescription because it was already locked up at the online pharmacy. So I said, well, this is when having a medical license is really handy. I said, hand me a prescription pad. And I wrote myself a prescription, and they said, okay, different doctor, we can fill it. But the insurance company actually can't pay for it because it's still locked up with the online pharmacy. But you can pay usual and customary, which is the price they charge at the pharmacy counter. The usual and customary for Tamiflu was $50. So this is where your company came in. You can go on costplusdrugs.com and actually get the drug at a cash price, typically, in many instances, lower than the copay and lower than the usual and customary. So why don't you tell us how that works and why it works?
So the reason it works and why it works is that when you go to costplusdrugs.com and you put in Tamiflu or any medication, if it's one of the thousands we carry, what makes us completely different is we'll show you our actual cost. And then we'll show you that our markup is only 15% and it's $5 for shipping and handling, or you may choose to accelerate the shipping because you need it the next day. And so in doing so, with only a 15% markup, we're almost always cheaper than everybody else, unless it's a $5 or under drug. And so that's really where we've built our patient base, is by being transparent. And one of the core fundamental beliefs that we have at Cost Plus Drugs is that we have to build trust. And I look at trust as an equation, right? Trust equals transparency divided by self-interest. And there's only two sites that show full pricing for everybody, and that's trumprx.gov and costplusdrugs.com. And so when you go with Cost Plus, you get to see our prices. You get to now compare it to your copay or your co-insurance, and boom, we're going to be cheaper, as you said, easily accessible, and that's why we're serving and helping millions of people.
Well, I really appreciate you calling out TrumpRx. As you know, there's about 50 drugs on TrumpRx, and the other day, everybody in the U.S. has their own politics, but what I've generally found is everybody wants to do what's right for the country. And when you saw that TrumpRx was allowing people to get drugs at lower cost than they could otherwise get, particularly the fertility drugs, in which there were additional discounts negotiated by my colleagues, I believe Chris Klump and John Brooks over at CMS, they did a great job with that, and you actually gave us a good shout out, which we really appreciated. So let me ask, why doesn't everybody do what you're doing? It sounds like it's the right model for giving patients control and power in the pharmaceutical market.
So first, shout out to Chris and John, because what they're doing over there really is important. Somebody trying to grow their family and can't afford it is something we hear about all the time, and so it's hugely important. And that's why I gave you guys a compliment. Why doesn't everybody do it? Because the way the system is designed right now, it's designed so that PBMs can maximize their earnings by pricing to market, as opposed to creating a cost and charging cost plus.
And what's a PBM?
So a PBM is a pharmacy benefit manager. A PBM started off really with the job only of adjudicating claims, connecting the prescription to the insurance policy and in processing the claim. But then, because they're able to control the formularies with so many people, that's giving them a great amount of negotiating power and allowed them to kind of force, particularly brand manufacturers, to set pricing. And in doing so, they'll set a different price for, depending on what plan you have, who your insurance company is, who the pharmacy benefit manager happens to be. And in doing so, they're trying to maximize their earnings, not minimize the cost to the patient. And really what you're doing with your data liquidity, since the whole idea of the real-time pharmacy benefits plan, benefits program, is to connect through those PBMs to try to get the data. And they even try to hide data from you guys when you do it, which is crazy, right?
Yep.
And so to answer your question, one of the fundamental differences between costplusdrugs.com and everything you've seen done connected to a pharmacy, the biggest pharmacy benefit managers, is that we charge the exact same price to every patient, no matter what the day, no matter where they're based, no matter what their insurance plan is or isn't, high insurance, high deductible, no insurance, it's always the exact same price. And when our costs go down, the patient cost goes down. Nobody else does that. And that particularly doesn't happen with pharmacy benefit managers. And that fortunately is some of the problems and challenges that you guys are trying to overcome with data liquidity, because sunlight is a great disinfectant, particularly in this industry.
It really is. And that's why we're so excited to get the cash prices from places like Cost Plus Drugs, from places like Trump RX, onto the real-time prescription benefit systems so that people know what their options are, not just the insurance option, but also the cash pricing option. I should tell you did a nice job of giving a call out to my colleague Mark Cuban. He actually started the Trump administration's work many years ago on lowering drug prices. He was the fellow who came up with the $35 insulin rule. And
oh, wow, I had no idea.
Yeah. That was his work. And, I think the experience there is instructive. Mark was able to call together insurance companies, drug manufacturers, patient advocacy groups, and the government and say, let's all get into a room and figure out how we can do the right thing for the American people. And so they decided that insulin would be $35 a month for people who needed insulin. And in order to make this work, it meant that the insurance companies had to make some concessions and pick up some more of the drug price of the patients. It meant that the drug companies had to make some concessions and take slightly lower profits. But the interesting thing is that everybody won. The total amount of money spent by Medicare on insulin actually went down. The insurance companies discovered that people were more compliant with their insulin. Instead of abandoning insulin or rationing insulin, they actually used it. And the complications of diabetes actually went down. And the drug companies actually found that their fill rates went up because patients were more likely to access the insulin when they can afford it. And so while everybody gave up a little, everybody ended up a little bit better off in the end as well. And it sounds like that's what you're conceiving of doing with this cash pricing approach that Cost Plus Drugs is taking.
Absolutely. And, we also partner with some of the pass-through PBMs, not the big three PBMs. And for their customers that have insurance plans that they adjudicate for, we'll work with them as well. So whether it's a cash price, whether it's claim for insurance, as long as they're able to pass through our prices as is, we'll work with anybody. We're excited potentially to work with TrumpRx.gov. I mean, we have an API, we've given it to them. Now we're waiting for them to turn it on. So, the sky's the limit across the board. And you're exactly right. When you bring in all the parties, typically, not always, but typically they'll try to do what's best for the patient. If there's somebody with a little bit of importance in it to try to bring them together.
Yep, 100%. And this is part of the Trump administration's broader attempts to bring price transparency to the American people. As you know, my colleagues at CMS, I believe Alec Armanda, worked very hard on getting hospitals to reveal their actual payments that they get for medical services so that particularly for shoppable services, patients can choose the lowest cost alternative of multiple hospitals or multiple doctors they might be interested in going to.
We haven't really talked about it, but that step led to us creating a company called costpluswellness.com, where I think there's going to be a lot more direct contracting. And what we're doing on costpluswellness.com is taking our direct contracts with hospital systems like Baylor Scott and White and publishing the actual contract so others can replicate it or use it as a template. So you guys set a precedent for a lot more than just transparency.
And so tell me what you hope Cost Plus Wellness brings to the market. What's the future state that you see?
Well, we talk about complications through pharmacy benefit managers and pricing and how they'll try to hide the prices. Well, they're owned by big insurance companies, or they own a big insurance company, right? So culturally and approach-wise, they do the same thing. And so hospital systems tend to have the same problems as independent pharmacies do. They get underpaid, late paid, and audited and clawbacks so that they don't really fulfill the published prices. And so what we said to the hospital system is, look, as an employer, I want to contract directly through you. And since I self-insure, I'm already paying my bills anyways. I don't want to have the insurance company in the middle. And so let's do a direct contract. I'll pay you on time. I won't underpay the contracted amount. I won't late pay it. And I'll even do my personal author, the pre-auth prior to going to you, so you won't have any denials to deal with. In exchange for that, I want a lower price, more like your cash price.
Right.
Because cash price for hospital services and providers is lower, just like it is for pharmacy, right?
Yep.
But I added one more stipulation. I said, in exchange for all of this, you'll get paid on time, etc. I want to be able to publish the contract so every other self-insured employer can replicate what we're doing and either go directly to you or use this as a template. And the response has been good. We haven't even formally announced it.
Wow.
It's only started in December, but the response has been incredible.
Now, have you found it interesting? You talk about you work with Baylor Scott and White. Have you found it interesting how much people are willing to collaborate to innovate and also, I guess, do the right thing by patients?
100%, right? It's typically like the president talks about the middlemen being the problem, and he's right. Whether it's the insurance companies and the PBMs they own, or the hundreds or thousands of subsidiaries associated with them,
Yeah.
most other than the middlemen, the providers in particular, the pharmacists, the doctors, all want to do the right thing for the patient. Yep. Always. I've never seen an exception at all, because that's why they got into the business, to really provide care. And I think once you get those stakeholders aligned, like you guys have worked so hard to do, then great things can happen.
100%. We're working very closely with insurance companies and providers to get the electronic prior authorization to happen in real time. And while we've already promulgated the standards to make this happen, to actually implement it in the market, much like your experience with broadcast.com, is a pretty heavy lift. And what we've found is, believe it or not, the insurance companies and the electronic health record companies are willing to work together and willing to put in the long hours and even make significant investments in order to see this work. And it's one of the interesting things that I've learned about government, and it seems to be something that you've had experience with in launching your companies as well. So let me ask, what is the future for costplusdrugs.com?
Well, our mission is to add every FDA-approved medication that we are legally allowed to sell. Our challenge right now is getting some brands, because we're completely transparent. Not all the biggest pharmacy benefit managers like that, but I know working with you guys and working with some other folks, I think we're going to get through that. The other thing that we do that we're really proud of is we have our own manufacturing facility in Dallas. And right now we'll make sterile injectables that go on the FDA short supply list.
Wow.
So for instance, there's still pediatric cancer medications that are generic that go on short supply list. Pitocin goes on a short supply list. So we're manufacturing that for hospitals. But the cool part is my co-founder, Dr. Ashma Yancey, who's also a radiologist, rocket scientist. This guy does math theorems for fun. And so using AI and robotics, we've been able to cut our costs of manufacturing significantly.
Wow.
To the point now, we've been able to modularize it. So we're going to create these pods that literally fit into a trailer that goes on the back of a tractor trailer that you see the trucks pull, so that we can manufacture everything from biologics to N-of-1 medication. So literally, for therapies that are being created for rare diseases, it takes about 6 months to try to get that into a manufacturing environment, and about $500,000. We're now already have cut that to $50,000 in a few months. And so we'll expand that. We can use the same foundational AI and robotics to do generic tablets, tableted generics. So we're trying to work with the FDA. It's kind of expensive to get the ANDA licenses, but if we get past that, the economics work where we literally can make fully manufacture from the API generic medications for less than we can buy them from overseas.
That's fantastic. You talk about the ANDA licenses. I'll have to introduce you, if you don't already know him, to my buddy Marty McCary. Maybe he can help you with that.
Yes. Yeah, I hope so. That's our guy. We're hoping.
I think it's so important that, particularly for the sole source sterile injectable drugs, that there be more providers of it, because, as you know, anything that interrupts the supply chain can really create a shortage. I have this absurd situation in hospitals where at times fentanyl, a drug that unfortunately is readily available on the street, is on short supply in the hospital, and we don't have it available because there's only a few suppliers of it. So
even things like sterile water, right, goes on short supply. I mean, it's crazy.
It really is. So we are looking forward, the vision of both the President and of the leadership here at HHS, Secretary Kennedy and Dr. Oz, is that we convene and collaborate, that we work through pledges and we use government's convening power. So I am really looking forward to collaborating with you and your team. You
Yep.
called out Alex. Guy's absolutely brilliant, and as a fellow radiologist, we're part of the guild. But Paul Vasquez has been spectacular to work with.
Yep.
I like to surround myself with people that are much smarter than myself, and as they will
Same.
readily tell you, they are. And
Yep.
it looks like, having worked with Paul and Alex, I have had the privilege of being surrounded by people much smarter than myself yet again. But we would love to get cash pricing on the electronic health records, and we're in conversations with the EHR companies now to make that happen. So that's a step in the right direction.
For sure. I mean, now the next step, and I know you guys are thinking through this, is how do we get those assigned to the deductible so that they count against the deductible? Because now that's available in 8 states. If we can make it happen federally or through your system, then everything changes, because that will bring a lot more honesty to the whole system. Because the one thing that the real-time benefits check doesn't do yet is apply it to your deductible or know where you are, how far along in your deductible you are, right?
Right.
And you don't want to go cash when you're right underneath the, fill in your deductible. So, one last step, and I think you guys have nailed it. I mean, you should be really, really proud of your data liquidity efforts, because like I said, touch once, available to everybody, makes the entire system more efficient. Add cash prices to it. Prices for everything will come down as a result because of all those options that are there. Implement TrumpRx.gov and cost plus drugs in there, and you truly will have changed the game for millions of patients, saving them probably billions of dollars across the board.
Well, I think we're doing great things here in collaboration with the private sector, and under the direction of President Trump and his vision, and Secretary Kennedy and his vision. And looking forward to collaborating, and looking forward to making the future that an entrepreneur like yourself so often brings into reality, to helping you guys bring that into reality.
We're really excited about it. And you know us, anything that we can do to make life cheaper for patients and better for patients, we're aligned with everybody and anybody who wants that mission to happen. And you guys are doing such a great job. So thanks for including us.
Yeah, thanks so much to you and your team. It's been great.
Thank you, guys.
Produced by the U.S. Department of Health and Human Services.